Welcome to Skin Sync, the official podcast of Elevate-Derm Alliance, your trusted source for the latest in dermatology for PAs and NPs. Join our hosts for real clinician perspectives and expert guest insights as they explore everyday dermatology topics with practical takeaways.
Hi, everyone, and welcome back to another episode of the Skin Sync podcast. I'm Buccinita.
And I'm Shannon Moranti.
And we are very excited to bring you another episode of Skin Sync. So make sure you grab your coffee, your hot cup of tea, a glass of wine, your notebook and pen, and get ready to learn about some OTC All-Stars. We'll talk about our favorite over-the-counter products to treat some of the common derm conditions. So Shannon, let's get started. So what's one of your top over-the-counter derm products?
So you know that I'm going to start with one of my all-time favorite skin conditions, which is acne.
Of course.
There's so much out there. There's so many overwhelming choices for our patients. And let's be honest, when you or I walk into the cosmetic section of any grocery store or drugstore, we are so overwhelmed with all of the ridiculous choices, and it becomes almost like sensory overload. So I love to keep it super, super simple for my patients and talk them through therapeutic options that are actually going to be helpful, not irritating, and calming. Because acne, as we know, is an inflammatory condition of the skin. So I like to start there. I like to tell them, hey, look, I know you've been told by social media or by websites on over-the-counter products that you need to use acids and dry this up and burn this stuff off and all the things. But I like to actually approach it like we need to calm your very mad skin down. So I know that you were paying attention, Bucci, last year when the whole BPO
Goodness.
benzene, kind of
Scary
conundrum.
times.
For sure. Yeah. So as we all know, in dermatology, we were kind of bombarded with some last minute information that a company came out saying that benzoyl peroxide products were releasing benzene. Benzene is a carcinogen, which if inhaled could potentially cause some very scary side effects. And benzene is a natural byproduct of benzoyl peroxide when it's broken down by heat. Now, what they didn't tell us is that it has to be above 114 degrees to 120 degrees for at least 7 to 14 days to even begin to release benzene. But those of us who work in the South could potentially have patients who leave products in cars, and that car could elevate to those, very high temperatures. So I like to recommend benzoyl peroxide products that are actually in a solid form rather than a
Interesting.
liquid.
Okay.
Have you heard of benzoyl peroxide bar soaps?
I have not, Shanna. Tell me more.
So I have a fan favorite, 111 Medco BPO bar soap. It's available on Amazon. It's actually a 10% bar soap. I'm a big fan of benzoyl peroxide, but as we know, the large molecule benzoyl peroxides can't always get into the skin and get into that pilosebaceous unit where we need them to get in and start to work. So the BPO bar soap by 111 Medco is one of my favorites. I do like a good cleanser without salicylic acid. I like to make sure that I'm giving them maybe something a little gentler, like a glycolic, or something that's not going to burn and irritate and dry out their skin. I want to give them a non-comedic moisturizer, something that's going to replenish and kind of restore and help heal the skin barrier. And I think skin barrier repair is important for all patients, not just our eczema patients. Do you agree? Do you talk about skin barrier?
I mean, to me, it's the foundation of really treating most chronic inflammatory disease on the face, especially rosacea, acne. So I don't leave a conversation without discussing skincare.
For sure, for sure. So I love La Roche-Posay's Lipicar line. I think that is very nourishing, very moisturizing. It's okay for babies. It's great for our eczema patients. It's certified by the National Eczema Association, but it's great for our acne patients. I like their purifying cleanser as well. I love the Cetaphil Purple line. Cetaphil, of course, has been around a very long time, and their purple colored brand is specific for acne prone patients, and it's not too irritating. Cream's an all-time fan favorite for sensitive skin patients and patients who are on medications that might be drying their skin out, like a lot of the prescription topical medications we give our acne patients. I also am a big fan of Aven. Aven is the thermal water from France, but it's very soothing, very nourishing. Their cleansers, their tolerance, moisturizer, very, very nourishing. And last but not least, certainly not least, huge fan of hypochlorous acid cleansers and sprays for my acne patients, especially for truncal acne, especially for my athletes. The CLN Sport Wash, 111 Medco has hypochlorous acid spray, which is super easy for the boys who don't want to reach their back or aren't, flexible enough to reach their back. It's an great option. How do you weigh on hypochlorous acid? What do you think about it?
So actually, I really like this ingredient, and that kind of takes us into another topic, another common condition that both you and I are familiar with in both Naples, Florida, and here in the Atlanta area is body odor, right? So
Ooh.
in these sticky, icky climates with lots of sweat, it's really common. And sometimes patients are embarrassed to bring it up to us, but it's something that we do have to treat in derm. So one of my favorites for treating body odor patients, whether it's underarms or groin or even the feet, is hypochlorous acid because it's usually not irritating, doesn't cause resistance, it's well tolerated. You can find it in different variations, sprays and cleansers. So CLN being one of the brands I love the most, but that's definitely one of my top recommendations there.
Love
And
that.
as you mentioned already, benzoyl peroxide comes out. This is a pro when it comes to body odor as well. The big thing with this is that you do have to lather it on and leave it on for a couple minutes before you rinse it off, especially when you're using it in the underarms. But it works beautifully for body odor. You do have to be cautious about your towels, of course, just like any other benzoyl peroxide product, so it doesn't bleach everything out. But that's one of my favorites. This one went viral. I don't know if you've loved this product for body odor, but glycolic acid toners and solutions. So did you ever use that?
Ooh, I don't recommend that
It went
typically.
super viral on social media, especially the Ordinary brand. I have not personally used it yet. I have not tried it. My patients seem to like it. I have seen definitely some irritant contact dermatitis from it, so you have to be careful, but that's been a really popular one. And then last but not least, I will say this is one of my favorites, but with some caveats, would be chlorhexidine wash, so Hibiclens.
Ooh,
If you've got some
yes.
stink, this is gonna take that stink down. So this is to me the most powerful agent when it comes to treating body odor. However, we've got to be cautious, number one, because it can be really irritating on the skin. And number two, we are both good stewards of antibiotics and antimicrobials, right? And so my
Right.
concern with overusing chlorhexidine is that we're potentially going to cause resistance. So I do like to use it to limited amounts, not overdo it with the patients. It's not an everyday body wash, but it does come in really handy and it works very quickly. And
Absolutely.
one quick note with that too is be cautious when patients are using it around their ears or eyes. It can be toxic to the ears, eardrums, and to the eyes. So just a quick little note there.
Love that. One more addition to the body odor list would be plain old white vinegar. So, believe it or not, we need to remind our patients that our apocrine glands that are in those areas that create body odor, typically at our folds, right, underarms and inguinal areas and what have you, the apocrine glands will put out this like a odorless fluid. But then mixed with the bacteria and the normal flora, it's not always bacteria, it can be yeast, it can be fungus, it can be any microorganism, and the microbiome of our skin, essentially. When that's off balance, those bacteria, yeast, fungus can go a little crazy. So actually doing white vinegar soaks, doing like soaking kind of 2 washcloths and stick them under the armpits and leaving them there for about 5 minutes before you shower, you're gonna smell like a stinky Greek salad for a little bit and potentially the next couple times you sweat, but it will not be as bad in the body odor department. So for our patients that are, a little more granola and want to be away from chemicals and use something a little more natural, that's a good natural option.
It's a great one. I have not heard of that before, but actually one that you might relate to being from a podiatry family is using white vinegar for green nail syndrome, right?
Yes, love that. I'm so glad you brought that up. So, for sure, in the podiatry world, they use a lot of antifungals. Of course, we always think that there's a fungus among us when we look at the feet, whether it's nails or podiatric dermatoses, athlete's foot fungus, Candida intertriginous or interdigitalis, rather, anywhere that there's little nooks and crannies that get moist, that stay dark, that stay enclosed. especially in a warm, humid environment, fungus and yeast just love to grow. And especially if the patient's natural pH is conducive to that, or if they're diabetic and they have a little bit more of a propensity toward infections, they're going to suffer from a lot of these intertriginous infections and nail conditions. So, love vinegar soaks for green nail syndrome. Green nail, of course, is typically caused by Pseudomonas, but also I love white vinegar for tinea pedis. It's kind of a poor man's cure for athlete's foot fungus.
Interesting. Never heard of
And
that.
also for paronychial conditions, like chronic paronychias that are going to be typically caused by fungus or yeast, doing vinegar and water soaks, typically half and half. And usually you do want to soak it for about 10 to 15 minutes, depending upon the body surface area and the amount of penetration and how thick that skin is. Just tell your patients we want to reduce that pH to a level where the fungus does not like to grow.
It's lovely. Super inexpensive, over the counter, smells a little funny, but highly
Yeah,
effective product for lots of conditions. So,
sure.
moving on to something that I certainly deal with myself, ingrown hairs, razor bumps, or as we call it in dermatology, pseudofolliculitis. And
Yeah,
when people hear this term, they think a lot about the face, like men who shave and get razor bumps. But I
right.
want everyone to really consider it for any patient who shaves in any area that tends to have thick terminal hairs. So we're talking axilla, we're talking the bikini and groin area. Pseudofolliculitis can occur in any of these areas. So I will share with you my all-star product, Shanna. And actually, before we do that, I want to mention that it's really not a benign condition. When we're dealing with pseudofolliculitis, yes, they're just razor bumps in some situations, and they can be mild and benign. However, for many patients, they're itchy. They can be quite
Sure.
painful. For your patients of darker complexions, they can cause a lot of hyperpigmentation and sometimes even significant keloid scars. Don't dismiss it. Make sure that you do address this issue. My favorite product for this is actually a product called Ten Skin. Have you heard of Ten Skin, Shanna?
I have not. Tell me all about it.
So Tenskin is this super old school blue bottle of salicylic acid solution. It comes in a liquid, like a aftershave. It comes in a nice roll-on, and it works beautifully. It's just a strong, concentrated solution. The one downside is that it does have some isopropyl alcohol, so you have to be careful. Do not apply it to freshly shaved, freshly
I was
waxed,
gonna
or
say
freshly lasered
not
skin.
use it as an aftershave unless you wanna have that
I have
Home Alone
certainly
moment.
it will light your skin on fire. So please do not
Woo!
do this. I have tested the theory myself.
My
But
gosh.
yes, be cautious with that. But it works extremely well for patients who get chronic ingrown hairs at any
How
location.
often do they have to use it, and, for how long?
So typically, I'll have them use it just once daily. If it's really bad ingrowns, maybe twice a day. And then once you get it under control, you might be able to use it every, 2 to 3 times a week for maintenance. So I just usually put it on a cotton pad if we're using the solution, or if you use the roll on, you can just roll it right onto the skin. But it works extremely well. But again, just be cautious because it does have the alcohol. It can burn and dry out the skin a little bit. So
That is
that's one of my favorites.
that is a fantastic tip. I'm writing this down.
And then my next favorite for ingrowns would be a combination of glycolic acid and salicylic, but these are like in pre-medicated pads. Two of the brands I like the most would be Replenix. They have a 10%, 5%, and or excuse me, 10%, 2%, and a 5%, 2% glycolic and salicylic. And another brand called First Aid Beauty has a similar concentration pad. It's not as irritating as Ten Skin, very well tolerated, a lot easier to use because it's already a pre-moistened pad. But those are one of my favorite products for treating ingrown hairs. So, any favorites for you?
Love that. Well, those products are actually some of the recommendations that I have for a very common condition called keratosis pilaris.
Yes.
I've oftentimes gone to First Aid Beauty because they have that nice balance of a glycolic acid, sal acid combination, both in a pad and also in a body wash. I love recommending the rough and bumpy formulations, CeraVe,
Yep.
Cetaphil,
Yep.
a number of products that have OTC rough and bumpy formulations are really, really good for our KP patients. There's KP Erase. There's so many different products out there on the market, but essentially you want to find something that's tolerable, that again does not light that tender skin on fire, because oftentimes our kiddos and our teens can have KP on their arms, their face, and their thighs, back, their buttocks, a lot of different areas. So we want to find something that's, user friendly, find something that has a concentration that is tolerable for your patients. Are there any other tips and tricks you have for KP?
No, you've really hit the mark. One of my favorite products is the Glytone KP kit. It's
Ooh, love
definitely
that.
more concentrated. It's much richer. The moisturizing cream that comes with it, there's a cleanser as well. But it's definitely a product line that I love for KP. So Moving on to something that I've actually presented on podium at conferences about acne keloidalis and also dissecting
Yes.
cellulitis.
I love these tips. I'm
So,
so glad you're bringing these up because these are some of my favorites that I have learned from you.
and I will shout out Dr. Matt Cyrus because he shared this on podium earlier this year. And so I took it from his lecture and I've been spreading it across the world. But for just those who aren't familiar, acne keloidalis, these little keloid-like bumps on the back of the scalp, typically in Black men, usually associated with shaving the hair too closely. And then dissecting cellulitis, we think of that as HS of the scalp, inflammatory, tender, boggy nodules throughout the scalp, also disproportionately affects Black males. But one over-the-counter product that you may need to consider is diclofenac gel, 1%. This is typically branded as Voltaren. It's actually used for arthritis pain, but there was some case series published that showed twice daily use of over-the-counter Voltaren 1% gel or diclofenac showed significant improvement. I was so excited by this data that I actually tested it on my younger brother, who has AKNs, acne keloidalis, on the back of his scalp. He got the German version, which was Smirch gel, Smirch Forte gel. I don't know how to pronounce it, but he got it in Germany. He used it twice daily for 1 week, Shanna, and it cleared completely. He did beautifully with it, so I was highly impressed.
I
So,
was so impressed by those before and after
yes.
pictures that you presented. It was absolutely mind-blowing. So excited that OTC ingredients can do really great therapeutic things.
Absolutely. So maybe an adjunctive product, it might be a monotherapy, but give it a try if you haven't already. It may work really well for you. So what else,
Awesome.
Shanna?
I think we have time for one more. Oh my gosh, this is so exciting. I hope everyone is writing all these good tips and tricks down. Let's talk about our favorite go-tos for another super, super common condition, seborrheic dermatitis. One of my favorite things to recommend for facial seb derm, and we finally have some phenomenal prescription products on the market, but OTC products. I love a good zinc Z-bar, and also that 111 Med Company has a zinc protheone bar soap. Great for facial seb derm. So for your older male patients or your older patients that have Parkinson's that are just coming in snowing in your office and their seb derm is all over their chest, recommend a really good OTC zinc protheone bar soap, and please help them with their little snow fest that's going on their chest at the moment.
And that's
What
a
else
great
are your
idea.
great recs for seb derm?
I actually don't recommend that one often, but I'm going to start because a lot of these older men just like bar soaps. That's just what they're used to using.
Cute. They
I
love
think that's an
it.
easy treatment. It doesn't conflict with what they normally do and obviously works really well. So, couple of my favorites. This actually is more for scalp psoriasis and really dense, scaly seb derm, but I do like salicylic acid shampoo, 5%. There's a brand called Kerolite that works really, really well. Lather it, leave it on for at least several minutes, rinse it out, works great. But my current favorite over the counter for seb derm is these Vichy Durcos selenium sulfide shampoo. I'm highly impressed with this product for many reasons. Number one is that they actually compared it to ketoconazole shampoo. It showed similar efficacy, but patients reported better hair quality. We all know that ketoconazole shampoo can be extremely drying. We know that
Yes.
it can be very damaging in patients who have textured hair because it causes dryness and breakage. So the selenium sulfide shampoo from Vichy, they actually studied it in patients who have curly and textured hair, and it did not cause increased dryness and breakage, and it worked beautifully for their seb derm. And I've actually seen this happen in clinical practice. So this is a product I absolutely love to use, and I think it's pretty reasonably priced for an over-the-counter shampoo. So
I
that's my
love that
fave.
so much, and I love that product as well, and love the fact that a lot of these over-the-counter companies are providing samples for our offices,
Yes.
for allowing us
Pretty
to,
generous
you know
samples.
really generous
Mm.
samples to allow our patients to try it before they buy it. So for all those OTC companies out there listening, and by the way, Bucci and I are not sponsored by any of these
Not at
companies,
all, not a single one.
completely unsolicited, but it's so great to talk with another super knowledgeable provider and what you recommend. And I think we just all can learn so much from each other. Bucci, thank you so much for taking the time to kind of hash through some of these super, super common conditions. And I hope for those of you listening, you all took notes and you can go into your clinic tomorrow with some fantastic over-the-counter all-star recommendations. This is the Skin Sync team signing off for now. Until our next episode, we are so excited to speak with you again.
Take care. Good night.
Thanks for tuning in to Skin Sync. Don't forget to subscribe to Skin Sync on Spotify or Apple Podcasts so you never miss an episode. To explore more of Elevate's educational and career resources, visit elevate-derm.com. Please note, this podcast is for informational purposes only and not a substitute for professional medical advice. Always consult a licensed healthcare provider before making medical decisions. Clinicians must rely on their own judgment and training in all patient care situations.